My name is Emily Wise, and I'm going to be presenting about alcohol use and addiction. Alcohol addiction is a disorder that affects many individuals worldwide and has many adverse effects that impact life in various ways. The American Psychiatric Association defined alcoholism, also known as alcohol dependence, as either a pattern of pathological alcohol use or impairment in social or occupational functioning due to alcohol, and either tolerance or withdrawal. The definition of alcohol abuse is a pattern of pathological use for at least a month that causes impairment in social and occupational functioning. Understanding dependence and abuse leads to defining addiction to alcohol as a chronic relapsing brain disease characterized by an impaired ability to stop or control alcohol use despite adverse consequences. With the presentation of this information, the target audience would be those struggling with addiction or people with family and friends who have experienced alcohol addiction to understand better how the brain works and the effects of alcohol and addiction. Diagnosing alcohol use disorder can be done by a medical professional or a licensed mental health professional. According to the DSM-5, AUD is classified based on the presence of 2 or more of the following criteria within 12 months. And that criteria is listed below, as alcohol is often taken in more significant amounts or consumed longer than intended. A persistent desire or unsuccessful efforts exist to reduce or control alcohol use. A significant amount of time is spent on activities necessary to obtain or use alcohol or recover from the effects of alcohol. Craving or a strong desire or urge to consume alcohol. Regular alcohol use leads to an inability to meet essential responsibilities at work, school, or home. Continued use of alcohol despite having persistent or recurrent social or interpersonal problems caused or exacerbated by the effects of alcohol. Significant reduction of important social, occupational, or recreational activities due to alcohol use. Recurrent alcohol use in situations in which it is physically hazardous. Continued use of alcohol despite knowing a persistent or recurrent physical or psychological issue is likely to have been caused or exacerbated by alcohol. Tolerance is characterized by either of the following: the need for significantly increased amounts of alcohol to attain intoxication or the desired effect, a substantial reduction in the desired effect even with continued use of the same amount of alcohol. Withdrawal demonstrated by either of the following: the presence of the typical withdrawal syndrome of alcohol, or frequent consumption of alcohol or closely related substance such as a benzo to alleviate or prevent the onset of withdrawal symptoms. And based on the number of criteria met, a patient can be classified as having mild, moderate, or severe AUD. Alcoholism is multifaceted and essential to understanding how the biology, psychology, and neurology of the disease are all intertwined. Starting with genetics, research has shown that 50% of the risk of addiction is contributed to genetics. Genes affect the ability to metabolize certain drugs, and individual differences in genes may contribute to a higher risk of addiction. Adolescents are at a noteworthy risk of addiction. The neuroplasticity of their brains relative to adults, as well as being more vulnerable to social stress, could be the reason why. The reward systems area of the brain matures before the prefrontal control circuits, therefore leads to more reward-seeking behaviors and a lack of impulse control in adolescent years. Alcohol can both activate the brain's reward processing system that facilitates pleasure, as well as decrease the activity of the brain systems that mediate negative emotional states such as stress, anxiety, and emotional pain. Behavioral effects and various actions are affected by alcohol by its metabolic products, such as acetaldehyde. This is the first generated product when alcohol is metabolized, which affects the activity of various neurotransmitter systems and in turn causes behavioral effects. The brain reinforcement system is affected by repeated alcohol consumption, creating cellular and neurophysiological changes. Depending on the genetic makeup of a person and other environmental factors determine if the behavioral response in the brain will turn into an addictive behavior. There are some fascinating facts about alcohol intake and abuse. According to the 2022 National Survey on Drug Use and Health, 29.5 million people aged 12 and older, which is 10.5%, and 28.8 million adults age 18 and older, which is 11.2%, had AUD in the past year. This includes 17.1 million men ages 18 and older and 11.7 million women 18 and older. And while men supersede women, according to this statistic, many women are still very much affected by alcohol use disorder. Alcohol abuse is responsible for 3.2% of deaths worldwide, as well as creating a financial burden on society of about $245.7 billion a year. Gender roles are another intriguing aspect of alcohol abuse and addiction. Research shows that females are more negatively affected and cue reactivity is more significant when drinking in the context of stress. Males seem to have more impulsive and less sensitive to the adverse effects of intoxication, leading to males being less likely to stop drinking. Males show more severe reductions in cortical thickness and reduced myelinated fiber density in the prefrontal cortex, whereas females show more robust decreases in neurogenesis in the hippocampus in response to alcohol. The negative impacts on the brain due to chronic alcohol use was severely impacted by gender. The brain is affected in many regions, and an intertwining of reactions can occur by several neurotransmitter systems, such as dopamine, corticotropin releasing factor, and glutamate. Following the first hit of alcohol on specific brain targets, the second wave of indirect effects on various neurotransmitter neuropeptide systems begins, leading to the typical acute behavioral effects of alcohol, with range from disinhibition to sedation and even hypnosis as alcohol concentrations rise. Dopamine release is aroused by ethanol in the nucleus accumbens shell region, and this neurochemical event is involved in the beginning of alcohol reinforcement. The primary mechanism that contributes to initiating the neurochemical event is the disinhibition of GABAergic neurons. Damage in the brain can occur to alcohol consumption and abuse, affecting the cerebral cortex and subcortical areas such as the limbic system, which is essential for feeling and expressing emotions, the thalamus, which is in charge of communication within the brain, the hypothalamus, which releases hormones in response to stress and other stimuli and is involved in essential behavior and physiological functions, and the basal forebrain, which is where learning and memory take place, located in the lower area of the front part of the brain. The image shows how alcohol affects the neurotransmitters in the brain's reward pathways. By promoting Y-aminobutyric acid subtype GABA, receptor function may inhibit GABAergic transmission of the ventral tegmental areas, thereby disinhibiting VTA dopamine, and as a result, these neurons release dopamine in the nucleus accumbens, activating reward processes there. Alterations in the GABA systems may be caused by chronic alcohol exposure. After prolonged excessive drinking, the potentiation of glutamatergic activity produces long-lasting plasticity, mainly in corticostriatal synapses, and continuous alcohol seeking. Impairments in neuroplasticity may inhibit behavioral elasticity and promote addictive behaviors due to chronic alcohol exposure in brain areas involved in cognitive processes. Non-pharmacological and pharmacological interventions are treatment approaches for those with alcohol use disorders. Over the years, there has been much progress made in alcohol pharmacology due to a better understanding of how alcohol affects the brain to produce specific effects. As of April 2006, there are 4 FDA-approved pharmacotherapies for the treatment of alcohol dependence, listed below. morbidity with other psychiatric disorders is substantially linked with alcoholism, so it is essential that clinicians are aggressive in screening and beginning treatment. An ideal situation would involve someone with AUD to obtain psychological support along with medications when needed. CBT has been proven an effective psychological treatment method in patients with AUD. Inpatient rehab is also a modality for treatment that can be highly effective. Only about 8% of individuals with AUD report receiving treatment in the last year. And research has been conducted to understand what affects treatment acceptance and outcomes. In general, the more socially and psychologically intact alcoholics were more likely to accept psychotherapy, while less socially and psychologically intact patients tended to accept treatment on the inpatient rehab ward. Psychotherapy seems to work best for patients who are socially and psychologically stable. Drug therapy has been seen to be more suitable and effective for patients who are socially intact but psychologically less sophisticated. And those who do best in inpatient rehab programs are those who are socially unstable but intellectually intact. There have been some potential breakthroughs in alcohol research and gaining better understanding of how alcohol impacts protein structure, function, connections, and networks through neuroproteomics. The information gained can help uncover valuable information for early detection and better prognosis of AUD, and possibly develop more effective treatment of alcoholism. Alcohol use and addiction can take over one's life and have severe adverse effects. Life becomes governed by the drug, and loss can occur in the ways of social compatibility, partners and friends, and jobs. And when addiction takes over, behavioral characteristics such as compulsive use, cravings, and chronic relapses may occur. Development of emotional or psychological problems, as well as short and long-term health problems, can occur. Some short-term health problems could include injuries, violence, high blood alcohol levels, and/or risky sexual behaviors. Some long-term health risks could include high blood pressure, heart disease, liver disease, cancers, weakened immune system, memory problems, and mental health problems. And it's interesting to note that typically chronic health problems due to alcohol use are generally seen more in women than in men. Tolerance and withdrawal can also have significant impact on one's life when dealing with alcohol addiction. Tolerance to alcohol is when effects are lessened due to repeated administration. Tolerance effects can occur due to changes in enzymes, changes in receptor density, and learning. Withdrawal is when the drug is absent and it is associated with increased neuronal activity and an overexcited brain and peripheral sympathetic nervous system. The symptoms of alcohol withdrawal often look like comorbid psychiatric symptoms. Alcohol use, abuse, and addiction affects all social and ethnic groups. No matter what your background is or what your socioeconomic class is that you fall into, it is almost evident that you probably know someone or have fallen victim to alcohol abuse or addiction. One's culture can play a significant role in accepting drinking alcohol and the stigma surrounding alcohol use. Some cultures use alcohol as a celebratory device, while other cultures drink alcohol regularly with meals. Socioeconomic status tends to have an impact on some aspects of drinking alcohol. Some research shows that people with high socioeconomic status drink more frequently than others, while low socioeconomic groups tend to drink larger quantities. Technology has also become an essential tool, and it is used in marketing alcohol for sales, but often the messages become too accessible to our younger audiences. This often leads to more exposure to alcohol and the desire to drink alcohol before the legal age of 21. Social media impacts those who view advertisements for alcohol and the social acceptance of drinking. While technology can provide positive outlets for means of access to therapy and treatment, numerous adverse effects of technology and alcohol affect many people. In conclusion, alcohol addiction is a disorder that affects numerous people worldwide, directly and indirectly. Alcohol addiction is a chronic relapsing brain disease characterized by an impaired ability to stop or control alcohol use despite adverse consequences. Diagnosing someone with alcohol use disorder can be life-threatening, but it can also be empowering in ways to hopefully gain control of aspects of life that have been lost. Alcoholism is multifaceted and essential to understanding how the biology, psychology, and neurology of the disease are all intertwined. While genes can have a vital role in alcohol addiction, many other factors play a role. Environmental and biological factors can impact individuals with alcohol addiction as well. The brain plays a vital role in how alcohol is processed and the behaviors that follow. Treatment options for alcohol addiction consist of pharmacological and non pharmacological interventions. Psychotherapy, inpatient rehab, and medications have been proven effective in treating those with AUD. However, statistics show a shallow rate of individuals who actually reach out for treatment. Adverse life effects, including short and long term health effects, along with many other negative impacts, can result from alcohol addiction. Alcohol abuse and addiction can affect anyone in the world. While culture can impact views of alcohol and diversity of socioeconomic class can affect accessibility, no one is immune to this disorder. Technology has made advertising alcohol more prevalent than ever before, increasing the likelihood of more people consuming alcohol. While alcohol addiction remains a severe problem in our society, there is hope and treatment available.